So today we'll speak about how this can all be manipulated. We talked about the pressure gradient, and we talked about ventilation and the mechanics that are required there. Today we're going to look at how we can regulate some of that stuff, okay? So how we can integrate what we already know about resistance and flow and regulate the flow into the lungs. So we'll speak about compliance and then later on resistance. Okay, so compliance in the lung is very similar to what we saw in the cardiovascular system. It's the ease with which the lungs want to be expanded or stretched in order to accommodate that flow of air. Now we can use this equation to represent lung compliance. So the pressure change here at the bottom, and we know that this represents our, what value does this represent? Intrapleural pressure subtracted from alveolar pressure. What does that represent? That's a value that we spoke about. Transpulmonary pressure. So our difference in volume, our volume change, divided by our transpulmonary pressure change, which is essentially that alveolar pressure minus the intrapleural pressure. And this is how we can calculate the lung compliance, the ease with which the lungs want to expand. So we know that compliance is really, really beneficial in the lungs. The lungs are highly compliant, and that's what allows them to expand so easily. We don't need much other force than those natural passive gradients that we talked about. And we'll talk about some pathologies that change that, but in normal healthy lungs, there's high compliance, which facilitates that easy inspiration. So if we see a smaller change in our transpulmonary pressure, then we can bring more air in easily. And we talked about that transpulmonary pressure as being what? What was another word that we used there? The distending pressure, right? The ease of distension, right? So if we keep our transpulmonary pressure high, then we keep our compliance high, or the ease with which the lungs expand. We can speak about some factors that influence compliance, such as elasticity. We already know this elasticity-compliance relationship. We talked about it extensively in the CVS system. So if something is elastic or becomes more elastic in nature, it loses its compliance. And the reverse is true. If something is more compliant, it's not as elastic. And so anything that increases the elasticity of the lungs makes the lungs less compliant. It makes them more elastic or stretchy and less likely to accommodate that volume coming in, that air coming in. Surface tension is another important factor in terms of lung compliance. Now we know that the alveoli have this ability, this natural tendency to want to collapse because of surface tension. And so this is a force within the alveoli that really wants to make them collapse on themselves in the absence of something we'll speak about. So that's caused by a thin layer of fluid that lines this alveoli. Now, water has this dual nature, and this goes back to some basic chemistry, but water has positive charge, negative charge, because of that oxygen on there. And so what we see is that water wants to attract to itself. So within an alveolus, we have all of this water, that lining of fluid in the alveoli, and that creates this force where those water molecules want to attach to the molecules on the other side. And so an alveolus wants to collapse naturally, okay? Now this great surface tension created in that situation makes the lungs less compliant, right? More surface tension equals less compliance. And what do we do to combat that? What decreases the surface tension? This is something we kind of mentioned earlier. What breaks up those interactions between those water molecules? Surfactant, right? So surfactant is where, this is where surfactant comes into play. So surfactant overcomes that surface tension and breaks up those water-to-water interactions and helps to keep the alveolus open and patent so that it can expand and accommodate air. Surfactant is an amphipathic molecule. It's a detergent. Where else do we see the word detergent? Yes, soap, dish detergent, laundry detergent, yeah? And detergents have that ability to break up those interactions. So that's how you get oil off of your dishes. It breaks up those oil to water interactions or those solid to liquid interactions, and you can get dirt out of your clothes or oil out of your clothes using these types of molecules, which are detergents, okay? And surfactant has that same effect. Do you have a question in the back? You guys have a question? No? Okay. Okay, I can repeat it. What did you miss? Yes. So surfactant breaks up those interactions that are naturally happening between the water molecules that are lining the alveoli, and that's what helps to keep the alveoli open and patent, and helps to keep the compliance in lungs high. Okay. Now, surfactant is something that makes inspiration easy. We actually generate surfactant. Anyone remember the cells that secrete surfactant? Type 2 alveolar cells, yep. Now, interestingly here, newborns have less surfactant because surfactant is actually secreted later on in life. So we often see premature babies that are born anytime before 36 weeks. They have less developed lungs, they don't have enough surfactant. And what do you think will happen in that scenario? What would you expect to see in a preemie? They have a hard time breathing. Yeah, they have that respiratory distress because their alveoli just collapse on each other. And so this is why we typically keep them and watch them. They're usually on a ventilator, which breathes for them, and you can give them exogenous surfactant until their lungs are matured enough to make their own surfactant. So really interesting and really important substance to have in the lungs. Okay, so this slide illustrates the relationship between the pressure that is required to keep an alveolus open, the surface tension that's generated in the alveolus that I was speaking about, those water molecules interacting, and then the radius or the size of that alveoli. So this relationship is called Laplace's law, and the name is not so important as to understand the connection or the relationship between these variables. So P here is representing pressure, the amount of pressure required to keep this alveolus open. T here is representing the tension or surface tension that's generated because of the interactions of that thin layer of fluid that's lining the alveolus. And then R is representing the radius or the size of the alveolus, okay? And so what we see is that a small alveolus needs more pressure to keep it open. A large alveolus needs less pressure to keep it open, according to this relationship. And what that creates in the instance of no surfactant, right? So there's no surfactant in this scenario, and that creates this environment where we have high pressure required here, low pressure required here. And so that's a gradient, right? That's a gradient from high pressure to low pressure, and that's not what we want. That is going to cause the air here to move into this larger alveolus, okay? And so that small alveolus, alveolus 1, will actually collapse down into alveolus 2, which is the bigger alveolus where there's that smaller pressure. So this is why we have surfactant. Surfactant combats this whole scenario. And when we have surfactant, it's present in more or higher quantity in smaller alveoli, and it's present in lower quantities in larger alveoli. And so this allows us to equalize the pressure that's required to keep the alveolus open. And so if the pressure is equalized, then we don't have any gradients, and we can have equal flow to all of our alveoli, okay? So having surfactant keeps the pressure among all the alveoli equal and prevents that pressure gradient that would otherwise be needed if we didn't have surfactant, okay? Really important. What's something else that equalizes the pressure between alveoli? There was a structure that we talked about that facilitated communication between one alveoli and its neighbor. The pores, yeah. So the alveolar pores, we said, were tiny communications channels that allowed one alveolus to communicate to the other. And that was a second factor that equalized the pressure that we see in alveoli throughout the entire alveolar sac, okay? So surfactant helps to keep our pressure equalized so that we don't see this collapsing of alveoli. All right, and that's what we can see on this side. So as we see here, those interactions are being broken up by that surfactant, that detergent, and so we don't have a higher pressure here. We have equal pressure between these two alveoli, and air is not moving from one to the other, but it's equal.